the idea, Shabab, it's very important. And this is, I think it's one of the important topics that it's more, حتى أنا, in my opinion, is more important than your actual education. You are the top of the pyramid of our students في المملكة. صح؟ أنا دخلت متوسط وفي ناس اتنقحت. دخلنا الثانوي وفي ناس اتنقحت. دخلت جامعة and you got one of the most difficult college to get in, medicine. And now في ناس اتنقحت, you're gonna graduate. And you become the most skilled, professional, highest paid governmental job في المملكة. So if you don't have a career plan, it's a loss for the country more than a loss for you. ماشي? It's really a loss for the country. And you will decide in 2, 3, 4 years, depending on which year you are in, what you're going to be doing for the rest of your life. صح? And the rest of your life is really the productive part. كل اللي كنت تسويه من أول is education, teaching, and you contributed to the social society very, very minorly if you did through volunteerism وكذا. So your contribution to the social society was very low. It's going to become all of a sudden very high. And once you graduate and you're practicing MD, you're a doctor. Now your social and academic support to this country is huge. Huh? And it goes so quick in your career, you don't even realize it. You're building a new generation, you're treating patients, you're developing science, the country will be on your shoulders, really, from all perspectives. Even if you do family physician, farar, you're still carrying the country on your shoulders, because that part is really aching us and aching the entire kingdom. So what I'm here to talk to you, not about your career, although you should think about it and try to find a way to figure it out. And unfortunately, it's still not in our curriculum formalized. There are trials to fix it. I'm here to tell you if surgery is good for you, or at least give you the steps to start thinking, is surgery good for you? And we have 3 questions. Sometimes surgery is good for you, but you're not good for surgery. It does happen, okay? And sometimes surgery is good for you, but we don't think you should be joining us. That's fine. But sometimes you are good for surgery and we would like you to join, but we're not talking to each other, so it doesn't happen. This is a disaster. هذا آخر واحدة is a disaster. واحد surgeon. And so the idea, this group come up, and they're students just like you, and they're trying to help you to at least decide surgery or no surgery. It doesn't give you all the decisions, but it tells you surgery or no surgery, and it's a big question. And the surgery involves general surgery بأنواعه, pediatric, vascular, thoracic, OB, gynae, ENT, they're all lumped under surgery in general. Ortho, yes, they're not exactly the same, but the architect more or less the same. The lifestyle more or less the same. The impact on the population is almost the same. Before I start, I want to give you, what do you expect to do as a surgeon? You're going to operate, أي سهلة. You're going to work on clinics, see patients, والله سهلة. You're going to talk to families, and there's a lot of family talk. لأنه you have families even in adult side and in children's side. Okay, you can participate in research, you can participate in education, and you can be a major important administrator. Hello? It's up to you. The education is long. You finish your med school, there's another 7 to 8 years for your residency and fellowship. So it gets even worse, that you're really building up a long career, and it's taking you even longer. Okay, so you have to make sure that the decision at the end is really right for you. It's very hard to back out, and halfway through your residency, very difficult. There are few realities in surgery. It is a hard-working condition. You're required to act functionally 100% at various times of the days with your various other social, economic, and health status. You are supposed to function at 100% and give it all to your patients. So it's hard. Our personalities are not the best, understandable. There is a good future outlook. Okay, you will never have a problem in your future as a surgeon. You can work and you're guaranteed to work. ماشي. There's a big time technology use in medicine. we're the most non-technology use. نحن كنا زي كرة القدم كذا، ما نبغى تكنولوجي، ما نبغى خط، ما نبغى فيه لمبات، هذا ما التنس كل شيء صار تكنولوجي. كرة القدم ما يبغى شيء. Surgery was always like that. I want to do it with my hands. I don't care about anybody else. Technology now is coming hot and heavy, and it's getting to medicine. Most people, radiology and radiation oncology, absorbed it, and now it's coming to surgery. Robotic, laparoscope, Da Vinci, remote surgical sites, operative remote operations. We're becoming really big in technology use. There's a major self-accomplishment, and you do reverse things quicker than anybody else in medicine. Hello? Even a 1% hydrocortisone dermatology takes you longer than fixing an appendix, or taking out a colon cancer, or treating a fractured bones, or taking out somebody's tonsils and adenoid. So the self-accomplishment, it gets to you quickly, within half an hour, 2 hours, 7 hours, worst case scenario, but it comes to you. ماشي? We service the community for sure. There is an intellectual and physical challenge, because you make decisions just like every other physician, and like critical care physicians and emergency physicians, sometimes you have to make that decision within seconds. With a difference, and you're taking a life, you're making a decision for a life of someone. At the same time, you need the physical ability that you can do it. Your hands and eye are coordinated, that you can do it. Okay? And the impact on both the academic and on patients' health is great. So let's get you examples of people who managed to make this work. Abu Qasim, you know him? Yes. Okay. Abu Qasim is one of the top 5 surgeons who had a worldwide top 5 surgeons who actually impact surgery outside of the Western world. And you can Google it. Okay. هو أظن الخامس أو الرابع. Okay. And he started cauterization, he started amputation, he actually used a catgut. تعرفوا catgut؟ ها في السوتشرز تلقوها في الوعار، هذا لا تكون هي تجربوا فيها لأنها رخيصة. إنها cat gut جاية من الgut of the cat, and so it's cheap. But he actually started it. Hello? Billrath, you know Billrath? You've heard of it? Stomach surgery, Billrath 1, Billrath 2. اللي ما سووا 451 لسه ولا 351, they don't know that. But that surgery was invented back in the 1800s, and it's still called by the same name. We still figure out all the problems, surgical problems in surgery. Is it Billrath 1 or Billrath 2? Hello? And this guy had invented a surgical procedure under his name. The other example is Whipple's. Whipple's أيامه في نص ال 1800. And it still is the same surgeon. It's still called Whipple's. It's Mr. Whipple's. Then we have another type of surgeons, Kocher. Kocher invented tools. The Kocher clamp or Kocher forceps are still used now, and it's called Kocher. نحن نعرفها Kocher والناس تعرفها Kocher. And so this guy, الأول invented concept, الثاني invented surgery, a third invented tools. Thomas Tarza. Either he did it all. He's a clinician, he's an amazing surgeon. He actually started liver transplant. Hello, he made liver transplant possible. Hello, حتى هذا colored فيعني شوية closer. He made surgery, liver transplant possible. He actually established immune suppression as a surgeon. He established immune suppression. He was a major scientist. Published 2,130 papers. شوف الريت حقه كم؟ 1 paper every 7 days. Until you can't even read a paper every 7 days. Forget writing it. Okay? Can you imagine? Machine. Imagine how long this guy sat on a chair and wrote. Very long. So, very long. He's a clinician. He's a transplant surgeon. Back in the 60s. Imagine transplant surgery how it was. Yani. Most complex. It's still complex. In the 60s, it was just invented. Okay? He invented he understood the whole liver regeneration process, the whole portal flow, the function of the portal flow through research. He did it all. He did animal lab, he did basic science, he did clinical trials, he did it all. من البنش إلى البيشنت. Okay? And so there are other examples like this. I'm telling you, you can be a scientist. Hello? You know him? Yes, no, maybe? Rabia. Abdullah Rabia is a surgeon, a pediatric surgeon. He is famous for conjoined twin separation. It got just published in World Journal of Gastroenterology as the highest series worldwide. So he's a good surgeon, there is no doubt. Look at what administration he had. ما حطيته ترى Ministry of Health. ما كفت الصفحة. Hello? He started from this university as assistant professor. Hello? King Said University, assistant professor of surgery. He was one of you. He was a graduate from King Said University, became assistant professor, trained in surgery, trained in pediatric surgery, and then he took every possible job you could imagine, from a program director to a hospital directory to a ministry. And he revamped the Ministry of Health since he joined. It's the first time ever the Ministry of Health has a clear mission, vision, and objectives during his time. So, not to make it long, there are a few things that if it's in you, you start feeling some excitement. Training is fun in surgery. Many people worry about residency. It's actually fun. It's a hard time, but it's fun. Medicine is hard, but it's fun. You're going to miss it once you're done. Not to go, هلا شفنا الفن. I see it backwards and say it was fun. We sat here وكنا نضحك على الدكاترة اللي بعضهم ما زالوا موجودين. بس دحين we vented out قلنا لهم ترى تكلمنا فيكم. الجوب security is granted. Whether you're in Skaka, Riyadh, Paris, Honolulu, Taiwan, you'll find a job. If you're a general surgeon, you'll find a job. Because people will always need surgery. Your mother will be always proud of you. أول يوم تدخل جراحة صرت جراح. صح؟ ولد الجراح. Surgeons are special, no doubt. We have a character. It's obvious. Some of you hate my guts. I understand why. And we have a culture also. يعني حتى the way we run things in the hospital, there's a culture. تروح المزن تلقاه مختلف. Okay? Peculiar. If you hate it, don't come. You'll have heroes. You always have heroes. Once you come into surgery, you always see someone. Maybe you hate many people, but it's someone you're going to say, I want to be like him. Well, the good news is, one day, a guy will look up to you and say, I want to be like you. And some of them are mentally retarded, some are not. They will look up to you. The other thing is, you'll change patients' lives. Changing patients' lives is really a major impact. There is nothing like, whatever you do, whether it's ortho, whether it's ENT, whether it's general surgery, whether it's vascular surgery, once you come out of the OR, you could see the face of the patients and the family of, alhamdulillah, okay? Especially in this community and in any community, you still get the life change effect on their faces, and if you did a good job. The last, and this is the most important, is that this has to come from your heart one day. I love to cut. Okay? If you're nauseous from this, go somewhere else. Let's go to the surgical interest group. Surgical interest group, thankfully, is actually are members of you, the medical students. They're here to try to help you to make that decision. Is surgery good for you or not? Unfortunately, we would love to have other specialty doing the same. It's you to do. Like now we have at least this, and it's one major division: surgery or no surgery. This is how we look at it anyway. And we always think non-surgeons, they're just complementary. And we could do their job, but we don't have time. So anyway, medical students based organization, they have certain criteria to try to help you. They've arranged some speakers try to give you about their life experience. You don't want to listen about pancreas cancer from me anymore. You want to listen about how's my life, work life, professional life. How does it mean? What's your day job? Where you sit every day? What do you do? Is a man in the clinic? And these things are important. How is it different from working King Faisal, National Guard, Shmesi, Yamama, ما تعرفوا هنا, جامعة, okay? هذه كلها في الرياض. So what's the difference between these? Is it the money? Is it the work? Is it the expectations? Or they're all the same? Are they all the same or not? Are they expecting from me the same or not? These things are important. There will be mentoring and shadowing that will help you to get these questions answered. There will be workshops, OR tours, so that you can get into the OR and see, so that you don't feel threatened the first time you go into the OR. There are surgical research opportunities, so at least you know what science and research means. Maybe one day you become a Thomas Starzer or similar. There are mini lectures also on more of a surgical career, not didactic lectures. Skill development، بعضها في skill lab، بعضها في education simulation center، بعضها هتكون in-house. They're good to develop your skills. Educational videos. There's a psychosocial, mostly for those who have difficulties in their study, and surgical support for the 351, 451 students, or any surgical students that needs help to go through their studentship. The team is huge. Forget about me, because I participate very, very rarely, because actually the rest of the group is here. Some of them on the male side, some of them on the female side. Noura is the president, but Ibrahim Zahrani is your co, and he represents mostly the male section. And there is a website that you can go to and tap on. I would recommend you try it. It's for free. There's no cost. If it works, perfect. If it doesn't work, it's another failure thing in the hospital. It's not your first. It's not your last. The group are really interested, not myself, but the group are really interested to help you or to make use of this. They themselves need it, but then it's for everybody. So I would encourage you to help them to make it successful so that other things work. Thank you. خلصت.